My name is Angela Keats. I'm a registered nurse and a community health nurse for the Monica Loomis Health Centre in Norman Wells.
My name is Jennifer Snodgrass and I'm a community health nurse here in Norman Wells.
I get to care for patients, both acute, chronic, and also with public health and child health and immunization.
It entails seeing, healthy patients for wellness type checks like well child, well woman, well man, to providing emergency care for, people with cardiac issues, traumas, any sorts of things like that.
Well, I'd like to see how our care affects people and if it's effective or not. It's not just I see you, treat you, and then I never see you again. We have a much better relationship, a closer relationship with the community.
The great thing about the Northwest Territories is you do work in a scope that you would sort of not see in the southern parts of Canada. Community health nurses definitely have more responsibility than you do working as a registered nurse in a hospital or even in an outpatient setting in an urban center. And then it's just a really nice work-life balance. Being in the north, you have lots of, sort of downtime and time to get out and enjoy the beautiful scenery that's here. So one of the big improvements that I've seen to technology since I've been in the north has been the PACS system, the X-ray system. Before, basically, we were taking pictures of X-rays that we took, which were already sort of poor quality because they were film quality, and we were having to send those to a physician via email to be read. Now we have PACS, which allows us to basically take an X-ray. It gets downloaded and sent either to Inuvik or Yellowknife. The physician can pull it up wherever they are and basically view the X-ray and give us diagnostics sort of right away, or assist in us diagnosing a patient with different ailments. That's been a really great piece of technological equipment. The HealthNet viewer is pretty good. It does allow us access to patient records, those sorts of things that wouldn't necessarily sometimes come in a prompt manner, so it just provides good continuity and follow-up for patients in terms of the care they receive.
I like the small community feel. I like that I see people out and about all the time. You get to see people healthy, you get to see people happy. It's not always about sickness, and you get to see children grow up.
So Norman Wells, one of the reasons we've worked all over Nunavut as well as a few communities in the Northwest Territories. Norman Wells is very appealing because it is very family focused compared to sort of other communities in the north. There is a large population of sort of families with young children, so there's a lot of great activities, really great bike rodeos. For example, at Christmas they do gingerbread house decorating. The RCMP and Santa Claus go around on Christmas Eve and deliver presents to each child they want. There's just lots of really good family focused activities. They have a skating rink, swimming pool, those sorts of things, don't really exist past Yellowknife. I mean, Inuvik does, but none of the smaller size communities like this have those.
Because it's such a diverse career that you could do anything that you wanted to. You're always learning. There's nothing that is simple or black and white. Everything is individualized, and you constantly get to educate yourself and educate others.
I think nursing is a really good career that provides you an opportunity to help people sort of all throughout the lifespan. You can be assisting a pediatric patient 1 minute, an older geriatric patient the next minute.